change lives, chasing all them green lights, throwing up the shade.
Hey y'all! Hi! How you doing? Y'all good? Oh my goodness, good morning. Wow, what a way to start the day. Did y'all have some caffeine this morning? No, not yet? You're naturally caffeinated? I love it. Let's give it up for Mental Health First Aid Missouri. So excited to be here. As they mentioned, we're so grateful to meet you here in St. Louis, y'all. And for the first time outside of the DMV, I was able to drive to the summit. I actually live in Southern Indiana now. So how long did it take y'all to get here? It took me about 4.5 hours. Anybody have a commute less than 60 minutes? Less than 60 minutes? There's my peeps right there that are local. Hey, y'all. What about more than 12 hours? Some folks have flown everywhere for 12 hours. Hi, everybody. Looking forward to today. Listen, as they said, I'm Tramaine EL-Amin. I'm the Vice President for Mental Health First Aid at the National Council for Mental Wellbeing. And this is the 10th summit, y'all, the 10th time. We've been together 10 times in person just to come together and meet up. And I'm so grateful that you are here. Today, when I thought about what I wanted to talk about today, I really want to talk about a concept that we refer to a lot. It impacts the way you carry out your role as instructors and coordinators, and it also affects the way that you use the tools that you give your first aiders and how they head out into the world. And in a word, that simple concept is really connection. I'm talking about the connections that you're building here. I'm talking about the connections you'll take back home. And I'm talking about the connections about why you even chose mental health first aid in the first place. I'm talking about your connections to the communities you serve. And I'm also talking about the connections that you make here at National Council and how all of us impact the world together. When I think about connections, I also think about our goal to train 1 in 15 people in the United States, right? Everybody, we all believe everybody should have a first aider in their inner circle, right? And you amazing human beings, you're the key to reaching that goal. You know better than anybody that mental health first aid is more than a course. It's part of a movement. It's how we're changing society to connect to each other. It's also how we're changing society to have more conversations about mental health and substance use challenges and to go beyond the discussion to action. You know, when I think about all the work that you do in your communities and the skills you're teaching and the connections you're sparking, what I've realized over the years is that they're bringing people together to solve other larger challenges. I have an example, and since we're in the Midwest, let's go a little further west on I-90 to Kansas. Where are my Kansas folks at? All right, there you are. The Association of Community Mental Health Centers in Kansas is a National Council member, and they recently got a grant to do instructor trainings as well as first aider trainings in youth and adult Spanish mental health first aid. And our friends in Kansas, they trained 12 bilingual instructors, including 2 in liberal Kansas, whose community is about 40% Spanish speaking. Now, okay, fun fact, did you know that liberal Kansas is also the place where Dorothy lived in The Wizard of Oz? Who knew? Well, listen, what I also heard is that the learners in those courses, they felt comfortable enough to discuss their own mental health challenges. Then they raised some other concerns and they brainstormed ideas to not only keep that mental well-being conversation going in their community and in their region, but then they also connected to lead some other discussions to solve other complex issues their community was facing. In other words, connection made conversation, and those conversations brought collaboration. And then they drew those resources collectively together to give information and help to places in Kansas that desperately needed it. Let's give them a hand for that impact. That's right. You know, that's how important the work that you do as an instructor is of mental health first aid. We've seen over time, it continues to transform communities. Connection is that key. So I have an ask. Let's look at your connections. Who are you serving? What communities are you connected to? Some of you are tied to communities based on your professions with some really unique needs, like the fire and EMS folks. Where are you? All right. What about military, corrections, right? Some really unique needs. Other groups are bound together by culture and language. And so we recognize that in the last year, and we've released some translations, which are really cultural adaptations with their own sets of images and scenarios. And we did that in 3 languages: Korean, Khmer, Chinese, and then we updated Spanish as well. And there's some others to come. The translation development process is another example of connection. We worked alongside some advocates, instructors, social workers, lawyers, counselors, pastors, and translators, and all these community members, and it was truly a collaborative effort. When I spoke with my colleague who led this initiative internally, Lorraine Cassian, she shared how during this multi-year journey, participants, they changed jobs, they experienced grief and loss, they dealt with illness, and they welcomed new additions to their families. But through all of it, they stayed connected. We all invested the time that it took to make this a reality because we wanted the same outcome, not perfection, but alignment. We wanted to demonstrate to the community that we didn't just hear them, but we're listening and we're embedding cultural nuance into mental health first aid and increasing access. We've also refreshed the youth mental health first aid curricula with new videos, so you have more to choose from. And in the last year, we've updated mental health first aid for public safety and mental health first aid for rural communities to version 2.0. And I just want to say we couldn't have done any of these updates, adaptations, or new courses without the instructors and national trainers who kept us on track. Where's my national trainers? Can y'all stand up in the room? Let's give those national trainers a hand. Like I said before, and I say it again, y'all make mental health first aid possible. And I'm so grateful for you. I also want to remind you of how important you are more broadly to the National Council. The lessons that you are teaching, the education you're delivering, it all supports a vision of a world in which mental well-being, including recovery from substance use, can really be a reality for everyone. So I want to just remind you of a few things that National Council has been working on as well. We're expanding community mental health, community behavioral health clinics, CBHCs, so more people have access to affordable care. We've been strengthening and growing the mental health and substance use workforce, creating practice improvement materials. And then our Medical Director Institute, they're finding ways to improve quality and access to care. And with your help through advocacy, we have hit a milestone. We've increased the federal budget for mental health and substance use care, which means that there's more funding in place to support your work and the work our members do. And with your help, the folks in this room, since 2013, 10 years ago, 28 states have made mental health first aid a priority and enacted policies that allocate funding for training. They require certification standards for public sector employees and establish statewide mental health training programs and mandates. That's something to celebrate. When I think about this, it's really about supporting the workforce. Getting this workforce development and funding is necessary so that when we say the E in algae, standing for encourage professional help. I'm just going to give you the answer. I know you knew the answer. Algae can help us be there. That help can be there. These are the things that we were just discussing and dreaming about 10 years ago at this very summit. And now it's amazing to see them becoming a reality. But it's not just about what we're doing externally. You all have been doing a lot of work. We're looking inward, and we're working on ways to make it easier to teach mental health first aid, to simplify what you do. There's a lot of people working on your behalf and for our common purpose. We've gone from just a few employees to having more than 80 focused on supporting you. But we know you're doing some heavy lifting. So we want to strengthen the network of instructors and connect you more to each other even more. To do that, your day-to-day client support team is increasing phone coverage so you can get the answers you need more quickly. Your client services team is creating tools to give you, new instructors, and we have quite a few of them in the room, a strong start, including onboarding emails and webinars. Your client success team continues to help you grow and succeed with resources like speed coaching webinars. And your operations team is improving functionality with instructional videos and materials about billing and navigating the storefront. So your experience is going to go more smoothly. We're also adding additional resources and tools and communities of practice so you can connect with one another. We just want more options in a virtual setting for you to share best practices across the country. And lastly, now you may know that I've been a part for mental health first aid for quite a long time, but I've only been in this role for about a year. And I've spent a lot of the last year traveling and listening to and collaborating with groups across the country to really understand mental health first aid in new ways. You could say I've been practicing the L in algae, right? And let me tell you, I have learned a lot. But most importantly, I think what I've done is come to a place where I see very clearly how mental health first aid is fitting into the larger ecosystem of support. Now that support that it's fitting into can impact locations as close as St. Louis and issues as distant as food insecurity and other health-related social needs. Now, with that new information that I've gained, what I'm asking you to do today, I need your help. Can I get some help? Okay, all right, I can get some help. All right, so today, I would love for you to build your mental health first aid connections here at the summit. You're surrounded by so many experts in this room. You have such a wealth of knowledge. You've got folks who have passion and compassion. Take the time to learn today. You always have learners. Sit in that learner's seat. Learn from someone. Learn new techniques for connecting with your learners. Listen to the thought leaders. Listen to the national trainers. This summit is really an opportunity for you to connect and make an even bigger difference in your community. The other thing, tomorrow, while you're at NatCon, because I know you're going to NatCon, right? Some folks are staying over for NatCon. All right, all right. We want you to get to know some people and some organizations that are within this larger mental health and substance use care community. See what you can do together. And after you get home, don't forget to remember. And I know that makes no sense, but just stay with me. We want you to practice what you preach. At the end of our courses, and you take one thing that you learned and put it into action. Choose one thing you're going to apply and establish one new connection. And then what I need you to do is tell me about it, okay? I want to hear about it on social. I want to hear emails. Just let me know who's that one connection you made and what's that one thing that you learned that you can take back. Because we're a team. We really are. Whether you're impacting people in your communities like our friends in Kansas or shining a light on the needs for your cultural adaptations and advocating for your community and translations. What you do not only is phenomenal, but it really, really matters. And with so much happening in our world where we don't have control, we often feel like we can't control so much that's happening. It's starting to matter even more. You are part of a global network of people making a difference. And I think you know that, right? Your instructors, your coordinators, your national trainers, the first aiders, the mental health first aid, and national council staff, and we are all connected. And I can tell you 10 summits in, I'm still so very happy to be connected to you. Thank you.